If you stop masturbating in old age, this is what happens. There's this unwritten rule book that society seems to hand us as we get older. A script that suggests certain parts of our lives or energy, our desires, our connection with our own bodies, are supposed to just fade away. For a lot of people over 60, this includes the very private, very natural act of masturbation. It's treated like a closed chapter, something you leave behind in your younger years. But what if I told you that closing that chapter isn't some passive thing? What if it actually triggers a chain reaction of physical and emotional effects that most people, and honestly, even a lot of doctors, just don't talk about? My name is Doctor, host's name, and I've spent years specializing in the complexities of aging. I've seen firsthand how simply misunderstanding our bodies can lead to problems that were totally preventable. Today, we're pulling back the curtain on one of the biggest unspoken truths of getting older. We're going to look at what the science actually says happens to your body when you stop this fundamental act of self-connection after 60. This isn't about shame, and it's definitely not about judgment. It's about feeling empowered through knowledge. Because understanding what's going on with your prostate health, your hormones, and your mental well-being is the first real step to taking control of your health for the long haul. Hook for men and women over 60. There's a natural, private part of life that often goes quiet without a second thought. But what if stopping this one act could set off a series of surprising and even serious physical changes that nobody ever warns you about? What if your body is running on a use it or lose it system that you're accidentally shutting down? Stick with me, because we're about to get into the truths that have been left unspoken for far too long. Section 1. The prostate health connection. Every man should know about. Let's start with a big one for men as they age. The prostate. It's a small gland, but it has a huge job in male health. And for decades, researchers have been looking into what keeps it healthy. One of the most interesting areas of study is all about the frequency of ejaculation. A major study out of Harvard, which followed almost 32,000 men for 18 years, came back with a really compelling finding. The research showed that men who ejaculated more often, at least 21 times a month, had around a 20% lower risk of developing prostate cancer compared to those who only ejaculated 4 to 7 times a month. This link was consistent across different age groups, which suggests it's a pretty steady connection. So, what's the logic here? Scientists are still digging into the details, but a leading idea is what you could call the prostate flushing theory. Your prostate produces fluid that's part of your semen. The thinking is that regular ejaculation might help flush out potentially harmful substances or carcinogens that could build up in the prostate over time. It might also cut down on inflammation, which we know is a risk factor for a lot of health problems. Beyond just cancer risk, sexual activity, and yes, that includes masturbation, is vital for the circulatory health of your whole pelvic area. Arousal and orgasm get the blood flowing, delivering oxygen and nutrients to all the tissues down there. When sexual activity stops, that regular boost in circulation goes away. Over time, Less blood flow can cause the tissues in the genital area to lose some of their elasticity and sensitivity, a process sometimes called atrophy. This isn't a disease. It's just a result of inactivity, kind of like how a muscle you don't use gets weaker. Keeping that circulation going is a key part of overall pelvic health for everyone. Now, it's important to be clear that this research shows a correlation, not a direct cause and effect guarantee. No medical group officially lists ejaculation frequency in its prevention guidelines right now. However, the evidence is strong enough that doctors can tell patients that a healthy and safe sex life doesn't seem to hurt the prostate and might even offer a modest bit of protection. Section 2, the subtle dance of hormones and how it affects. You hormones are like the conductors of your body's orchestra, managing everything from your energy to your mood. As we age, that orchestra naturally starts to play a different tune. But sexual activity, including masturbation, has a fascinating part to play, not by stopping aging, but by helping to keep these important hormones in balance. When you have an orgasm, your brain lets loose this wonderful cocktail of neurochemicals. You get dopamine, the feel-good hormone that's all about pleasure and motivation. Oxytocin, often called the love hormone, which brings on feelings of calm and connection. And endorphins, your body's own natural painkillers. Let's be real. Stopping masturbation isn't going to cause some kind of hormonal collapse. That would be an exaggeration. The hormonal boosts from sexual activity are often temporary, but the benefits of these regular, temporary boosts are huge and well documented. This hormone release is a powerful, natural way to manage stress. In a world where older adults often deal with unique stressors, from health worries to loneliness, having this built-in relief system is incredibly valuable. And what's more, these hormones are directly tied to better sleep. The release of oxytocin and prolactin after an orgasm helps you relax and can lead to deeper, more restful sleep. A lot of people know this intuitively, using masturbation to unwind at night without even realizing there's a biological reason. It works so well for men. While testosterone levels do decline naturally with age, some evidence hints that a total stop in sexual stimulation could make that drop happen faster. Regular sexual activity is part of a lifestyle that signals the body to keep its hormonal rhythm going. For women, especially after menopause, sexual stimulation is key for keeping blood flowing to the genital area. This increased circulation helps maintain tissue elasticity and natural lubrication, which can fight vaginal dryness and discomfort, common issues that often go completely unaddressed. Deciding to abstain means you're missing out on these regular, helpful hormonal pulses that support your mood, sleep, and general sense of well-being. Section 3, taking care of your foundation, pelvic floor and circulation deep inside our bodies. There's a group of muscles that acts like a supportive sling, known as the pelvic floor. These muscles are absolutely essential for some of our most basic functions, like bladder control, bowel function, and sexual health. And yet, most of us completely ignore them until a problem pops up. This is where masturbation plays a surprisingly helpful role. An orgasm triggers a series of involuntary rhythmic contractions of the pelvic floor muscles. You can think of it as a focused mini workout for this critical muscle group. Regularly engaging these muscles through orgasm helps. Keep them toned and strong. Why is this a big deal, especially after 60? Strong pelvic floor muscles are your best defense against issues like urinary incontinence, which can be a problem for both men and women. For men, these muscles also help with erectile function, since they assist in trapping blood in the penis during an erection. For women, a toned pelvic floor is linked to better sexual sensation and overall comfort. Of course, masturbation isn't the only way to work these muscles. Specific exercises like Kegels are super effective and often recommended by doctors. But masturbation is a natural, and let's face it, more pleasurable way to make sure these muscles get regular engagement. This all ties right back to circulation. Like we talked about earlier, sexual arousal is a powerful way to drive blood flow to the pelvic region. This isn't just a fleeting thing. It's a process that nourishes the nerves and tissues, keeping them healthy, sensitive, and responsive. When this activity stops, the area gets less of that regular circulatory boost. For women, this can lead to vaginal tissues becoming thinner and drier. For men, it can impact the responsiveness of erectile tissue. This is the classic use it or lose it principle in action, not in a scary, irreversible way, but as a slow fade of function because of disuse. Keeping this activity going helps keep your body systems primed and ready, preserving how you feel and function long into your later years. Section 4. The mind-body link. Your psychological well-being and self-esteem, the physical benefits we've been talking about, are deeply connected to our psychological and emotional health. If you ignore the mind-body connection, you're only getting half the picture. Masturbation is way more than just a physical release. For many, it's a crucial act of self-care and self-connection. That hormonal cocktail released during orgasm is a powerful, natural antidepressant and anti-anxiety mix. Dopamine gives your mood a lift, oxytocin is soothing, and endorphins create a sense of well-being. Passing on this consistently means you could be missing out on one of your body's best built-in tools for regulating your mood and handling stress. This is especially true in later life, when people might be dealing with more feelings of loneliness or anxiety. But beyond the brain chemistry, there's the huge impact on self-esteem and body image. Aging brings all sorts of changes to our bodies. Society often pushes the message that these changes make us less vital or attractive. Masturbation can be a powerful way to push back against that story. It's a chance to stay in touch with your body, understand its changing needs, and confirm that pleasure and vitality don't have an expiration date. It gives you a sense of control and confidence, reminding you that you are still in charge of your body and its ability to feel good. When this kind of self-exploration stops, it can sometimes create a quiet sense of being disconnected from your own body. You might be going through the motions of your day without really feeling present in your own skin. This isn't about causing deep psychological damage, but more about a slow wearing away of the connection to yourself, getting back in touch with. This part of your life can be like a form of meditation, a way to listen to your body and affirm that you are still here, and you still deserve to feel good. This feeling of self-connection can boost your confidence in all parts of your life, including in your relationships, by helping you better understand and talk about your own needs. Conclusion and CTA. So, what's the takeaway here? The evidence is pretty clear. While masturbation is a personal choice and not something a doctor will prescribe, choosing to stop in older age means you might be missing out on a whole range of potential health benefits. It's a natural, healthy activity with no harmful side effects. We've seen how regular ejaculation is linked to a lower risk of prostate cancer in men. We've talked about how the hormones released during orgasm can seriously improve your sleep, lower stress, and boost your mood. We've uncovered why keeping your pelvic floor strong and circulation healthy is so important for both urinary and sexual function. And we've touched on how staying connected to your body is essential for your self-esteem and emotional health. The point of this conversation isn't to tell you what you should or shouldn't do, but to give you the information to make a choice that feels right for you. Aging well is all about knowing what tools you have to keep yourself healthy and vibrant. Your sexuality is a basic part of being human, and it definitely doesn't have an expiration date. If you found this information helpful and believe in having honest, science-based talks about health, please subscribe to the channel for more insights. And if you know someone who could benefit from this message, a friend, a partner, a family member, share this video with them. Let's work together to break the silence that surrounds aging and sexuality.